Everyone, my name is Nalucha and I'm a nutritionist working in collaboration with Daisy Care Zambia. As you know, the month of December has been HIV Awareness Month, and I'm here today to focus on the role that nutrition plays in the managing of HIV and AIDS, particularly the medical nutritional therapy. In the presence of HIV infection, nutrient requirement increases and the HIV infection impairs both nutrient intake and uptake. Poor nutrition therefore increases the risk of opportunistic infections and causes acceleration in progression of HIV to AIDS. In addition, maintaining good nutrition helps in reinforcing the effectiveness of antiretroviral drugs by improving their tolerance and safety. The Health Organization, WHO, recommends that people with HIV consume more energy to meet the increased nutritional needs that result from infections and metabolic changes from the HIV infection. These energy requirements vary based on the stage of the HIV infection. An HIV-positive adult with no symptom requires 10% more energy over the level recommended for a healthy non-HIV positive adult of the same age, sex, and physical activity level, while an HIV-positive adult with symptoms requires 20 to 30% more energy over the level recommended for an HIV-negative adult of the same age, sex, and physical activity level. These energy requirements translate into approximately 3,000 to 3,500 kilocalories for a patient who is asymptomatic and 3,500 kilocalories to 4,000 kilocalories per day for a patient who is symptomatic. These daily energy nutrition requirements should be derived mainly from food, and these can be sought from the 3 macronutrient groups of carbohydrate, protein, and fat, 2 micronutrient groups of vitamins and minerals. Recommended that the carbohydrate source should be of whole grain nature from sources such as oats, millet, maize, sorghum that translate into products such as whole wheat bread, brown rice, brown pasta. And for protein, lean sources, that is, ones without the fat trimmings, are recommended, and these include lean cuts of chicken, lean cuts of beef, fish, legumes, beans, cowpeas, soya beans, and nuts. For fats, it is recommended that they should be unsaturated in nature, and these include your vegetable oils such as your olive and sunflower oil, as well as nuts, nut butters, and oily fish. And for the micronutrient group of fruits and vegetables, all fruits and vegetables are recommended. Your green leafy vegetables, your colorful vegetables, your colorful fruits, and fleshy fruits. In episodes of acute illness, poor oral food intake due to effects or symptoms of medication or increment in nutrition requirements, nutritional supplements such as oral feeds may be needed. For patients who are symptomatic, a high energy, high protein diet is recommended. It is important to note that because the immune system of patients living with HIV is compromised, they are susceptible to water and foodborne infections. Therefore, good food and hygiene and safe food handling practices are recommended. These include washing hands before and after a meal, as well as washing utensils before and after food preparation. High-risk foods such as raw or undercooked meat, fish, eggs, unpasteurized milk, and blue cheese should be avoided. There are certain symptoms that may impair the intake of food and subsequently affect the meeting of nutritional requirements per day. These include loss of appetite, nausea, mouth issues such as mouth ulcers. In the case of these, for loss of appetite, it is important that consumed are energy dense, and these can be foods that are fortified with nut butter such as your peanut butter. For nausea, it is recommended that patients eat smaller meals throughout the day as opposed to eating 3 big meals. Dry foods such as crackers can also alleviate the nausea. And if a patient is nauseated simply by the smell of cooking, they may ask somebody to cook for them. For mouth issues such as mouth ulcers, it is recommended that foods such as vegetable are cooked to a point where they are soft and not crunchy. And Foods that are spicy and acidic should be avoided. It's also recommended that a patient rinses their mouth before and after they do eat. One last recommendation is that patients should make sure that they are having at least 8 to 10 cups of water or at least 2 liters of water a day. These may increase in the case of nausea or diarrhea. Thank you for watching.